Hey, it's Ryan Reynolds here from Mint Mobile. Now, I was looking for fun ways to tell you that Mint's offer of unlimited premium wireless for $15 a month is back. So I thought it would be fun if we made $15 bills. But it turns out that's very illegal. So there goes my big idea for the commercial. Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. New customer offer for first 3 months only. Speed slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.
Does it ever feel like you're a marketing professional just speaking into the void? Well, with LinkedIn ads, you can know you're reaching the right decision makers. You can even target buyers by job title, industry, company, seniority, skills. Wait, did I say job title yet? Get started today and see how you can avoid the void and reach the right buyers with LinkedIn ads. We'll even give you a $100 credit on your next campaign. Get started at linkedin.com/results. Terms and conditions apply.
Welcome, everybody, to this week's podcast episode for the Financial Freedom Podcast. I'm your host, Dr. Christopher Liu. And as I talk about 4 different types of freedom: time, financial, location, health freedom. And in that light, I'm always interviewing physicians, entrepreneurs, people on the cutting edge, sharing their messages and leaving you with words of inspiration and encouragement. So today we have a good friend and colleague, Dr. Pranay Parikh. And he's actually co-founder of Passive Income MD, also involved co-founder of Ascent Equity. And he also has a podcast host of From MD to Entrepreneur. So he's very successful, very busy. He's also practicing physician. So today we're going to talk about transitioning out of your day job, work-life balance, strategic partnerships, and it's going to be a fantastic discussion. So I'll welcome him to the show. Pranay, welcome.
Hey, thanks, Chris. I appreciate the opportunity.
Yeah, I know we've known each other for almost 3 years now, and we've collaborated together. Tell us more about what you're doing for the audience, and we'll go from there.
Yeah, a couple of different things that I'm doing. Peter and I co-founded along with Myth Ascent Equity Group. And so to take a step back, Peter Kim, that is, we created a course to teach people about syndications. And now people know what they are. Back about 4 years ago, there wasn't much information out there about it. And I know people come to you to get coaching because exactly, they don't know where to go, who to talk to, and to find vetted sponsors. So we created this course for people that want to do more do it yourself. And then we thought we were done, right? We taught people how to do it, but a lot of people would come to us and say, hey, now that we know how to do it, we're too busy. And you guys, as in Peter and I, are already investing in deals. Why don't we all just come together and maybe we'll get better deals and better terms? So that's how Ascent Equity Group got started. We first took a small piece of very large deals and we would negotiate and get better terms. But now we're able to take down whole deals ourselves.
Yeah. And it's fascinating because you've grown a very vibrant physician community. You have your conference too, which is every year. And so it's great to see building a community, giving back. Today, we'll talk about, first thing is like this idea of transitioning out of your day job. Why do anything outside of your day job?
I think for me, I was actually always interested in a ton of stuff. And it's funny because before you get into medicine, they want you to be well-rounded, right? Have all these hobbies and do all this stuff, but medical school and residency beat it out of you, right? So for me, I was always enjoying. I remember walking in the halls in my residency and seeing a bunch of art in the walls. And so I talked to my program director. I was like, hey, who gets to decide what kind of art goes on the walls? Can I be part of that committee? And my program director was like, don't you want to do fellowship? Like, why are you getting distracted? And that's probably why I didn't get into fellowship. But I was super interested in all this stuff. So after I became an attending, I just followed what I was interested in. I did some teaching at USC, University of Southern California, worked with Peter and all this stuff. And then the money came eventually. And a lot of people think that you have a binary decision. You're either 100% in medicine or you're 0%. And I think there's such a big spectrum. And that's actually what I teach people. My podcast is From MD to Entrepreneur, but it's not go leave medicine. For some people, that'll be the right answer. But I think for most people, they'll cut down their shifts to a certain amount and that'll be sustainable. And that's my goal, to give people the chance to work in medicine for a while, because we're having this epidemic of burnout and it's causing people to leave medicine early.
Mm.
And we need a lot of doctors, and most of the time it's the really experienced doctors that are leaving.
Yeah. Yeah. Which brings us the question, especially after 2020, wake up call for the entire world. Tell us this idea of like doctors needing side hustles. There's this very fine balance. Tell us more.
Yeah, and it isn't necessarily a side hustle. It's something else other than clinical that's making you money. For example, regardless of, say you're in interventional radiology and you're making $1 million an hour, but still an hour of your time, right? It's an hour away from your family, an hour. There's also, I'll talk about side hustles in a second, but there's also something called an intrapreneur, where you're almost like an entrepreneur, but inside your business. For example, at my hospitalist group, I'm a director of education. And that wasn't a position that was created before I got it, but they saw all the educational content and videos that I was making outside of the group. They were like, "Hey, could you do that for us?" I said, "Sure." And I did some, right? I did some for free. And I was like, "Yeah, if you guys like this, I can do more of this, but I need to sacrifice some of my clinical time."
Yeah.
And then they made it worth it. And now I'm looking to do that further in my clinical job. So work less clinical, and it's almost like an administrative job, but I get to do something I'm passionate about, and I don't really have to talk to administrators. It's nice. But that started because I showed them that I was doing something on the side that they wanted. And I actually just had a conversation with one of our administrative fellows yesterday, and she's like, "Okay, I don't know where to start. Start with what you like." Right. And people always like, "How am I going to make money from that?" But that's okay. Don't worry about that. That will come eventually. If you do the right thing for long enough for the right people, the money will come.
Yeah.
We didn't get paid for the longest time when we did any of our stuff, but
Yeah.
now we do, and it's a good living.
Yeah. It's so interesting because, especially for physicians, the main limiting factor is time. Either more patients, or you bill more, or you charge more, or you. So it's all this is time. But if you build side income streams or different things that can lead to different opportunities. Another question is this idea of medicine. We have this, like you're describing, where they want you to be well rounded before, and then now all of a sudden they want you to focus on just treating patients. How do you feel that medicine prepared you for entrepreneurship?
Actually, on Kevin MD, I have two articles. One article is why doctors make bad entrepreneurs. And I talk a lot about perfectionism, being risk averse. And then another article that doctors make great entrepreneurs. And I think both of those are true. It just depends on what you choose to believe, right? And so think about it. Like we went through residency and it was tough. We naturally are leaders, right? Think about codes, and you're managing a literal dying patient and you're telling the nurse what to do, the RT, potentially you're doing a procedure at the same time. So we are natural leaders. We can manage teams. We are super persistent, right? Perseverance. So I think a lot of the skills that we learn through fire of residency and medical school make us good entrepreneurs. It's just a lot of believing in ourselves. One thing I hear all the time is, "I'm just a doctor." It kills me every time. It's that you're a doctor. Like you're probably the most intelligent person, most educated in a room, but you've also been through and shown that you can handle pretty much anything.
Yeah. Yeah. Yeah, that's another reason why medical school needs to have entrepreneurship, maybe like an elective or business. One thing that I've really been impressed with, so you co-founded Passive Income MD, which is education and community, and then going into syndications. Tell us about strategic partnerships and scaling quickly.
Sorry, one small thing. I work for Passive Income MD, but not co-founded. I wish I
So-
co-founded that one. Peter had been creating it for a couple years, or he had created it a couple years before I joined. And one of the reasons that I've been like, people are like, "Man, you came out of nowhere." And it was like a year out of residency that I started going out I became quote unquote known in the world of physician finance and all this stuff. And that's because I worked with someone like Peter who had been building this company over time, and I worked for free. And the story how I met him is I made about a year, 6 months out of residency. I was like, okay, now I'm making pretty good money. You're at least making 10, 20,000 a month, right? It's a
Yeah.
lot of money for most people. So I'm making decent money. Now I need to decide on how to keep most of it, right? And to help it grow. So I made the decision. I'm like, okay, there's all these online groups. I'm going to decide to be more involved, whatever that means. So I'm just going to make this decision. About a week later, someone posted in one of the Facebook groups, and it wasn't even Peter's group, that if anyone lives in LA. So I posted, I was like, hey, I live in LA. I'll host an event. I'll pay for it. I'll clean up. Like, I just want to be involved. And Peter actually saw that and messaged me. And he's, oh, you want to get on the phone? This was back before he was super famous. So he could do that. But our very first phone call was 3.5 hours. We just
Oh,
like instantly connected. He
yeah.
was, yeah, I have this Facebook group. It has 3,000 doctors in it. Do you want to help me grow it? I was like, yeah, sure. Like, I don't know what to, I'll never grow in a Facebook group, but I promise, like, I'll try my best. And I helped it grow to 10,000 doctors before someone else took over. And I didn't get paid for that, but I got exposure. But then I also showed that I'm willing to work and that we have a connection. And then we created the course, which I got paid for. And now Ascent Equity Group, we own $250 million worth of real estate in the past 2 years. A lot has grown from that one phone call and relationship.
Yeah. What is your you talk about scaling quickly. What is the secret to scaling so quickly?
Keep doing it, failing often. For the Facebook group, it was just I would post. I told Peter I will post every day. And the Facebook group was dead at the time because Peter wasn't posting on it. And it was just persistence. I would see what would work and do more of that, do less of what didn't work. But it was just showing up. And then a couple people comment and the algorithm works, right? The algorithm, it's this positive feedback loop. If you get some posts and some likes, then the post will be more likely to pop up in someone's Facebook feed and they'll be more likely to comment and vice versa. And it goes the other way too. So it's just persistence and just Googling like what other people do, just doing some basic research. And that's the other thing about doctors. We're good at learning something in a short period, right? You had a 6-week rotation of surgery and you had to learn everything you could about surgery, right? Or 6 weeks of OB-GYN. And I remember before my OB-GYN rotation, someone said, this will be the last, if you're not going into OB-GYN, of course, this will be the last time you learn anything about OB. So I was like, oh, shoot, I need to learn how to deliver a baby. So, man, I delivered tens of babies. And it's being able to, and you're studying, right? You're learning all of the theoretical stuff as well. So if you can learn a whole medical practice or a majority of it in 6 weeks, you can pretty much teach yourself anything.
Yeah. Yeah. Now we'll transition to family. I know you have a new addition coming along the way. Family is the most important thing to you. So how do you balance that with all you have going on?
Intention. And that's really the only thing. You got to schedule family time, right? And no sacrifices. And once you make that a rule, it's easy, right? So if you have a meeting and you got to go to a doctor's appointment, you cancel the meeting, right? And yeah, I'm in a position where that's more tenable. In the starting, when we didn't have any help with our son, I would do all my Zoom calls with a baby in my hand, rocking him up and down to the point that if I ever do the Zoom call or meeting without the baby, people would ask where it was. These are like Zoom calls with like hundreds of people on it where I was one of the speakers, but it is what it is. And I distinctly remember in the beginning, your son or daughter falls asleep in your hands and on your chest. And it's just a great feeling. You're laying down. You're like, man, this is the best thing in the world. Oxytocin is going crazy, right?
Yeah.
And then one day, just didn't like it anymore.
No.
And it was like month 3. I was like, what? Already? Already? I wasn't prepared. No one told me it was go away this quick. So I think you got to take the time and enjoy it, right? Because it goes quick.
Yeah. Yeah. I know because my nephew, last time I checked, he was like 2 years old and now he's 9 years old and he's like growing. And so that, yeah, it's like you have to really cherish those time and those moments. Fantastic discussion. One final question is, if you had to do everything again, would you go to business school? Would you still become a doctor? What would you do differently?
One of the hardest things to do is to get an audience. And as a physician, you have an audience of a ton of other physicians. So I don't know if things would have changed. If I could do it again, I'd probably go into tech and be retired on a beach right now, like all the other people in tech. But I think I had a pretty roundabout journey. I didn't get into med school like that easily. I didn't get into fellowship twice. So you hear all these successes, but I got rank 9 on my match. But then I transferred into USC, right? I got like a 99 percentile on my in-service. So it balanced out. So a lot of the hits and setbacks that I took along the way, I really would not change anything, even all the embarrassing parts, because it got to me, it helped me. And sometimes I have to be like taken out back and slapped on the backside of the head by life to get some of these hard lessons. I'm hard-headed sometimes. But I needed all those to get to where I am. I'm pretty happy with where I am. It would have been nice to learn these lessons a couple years earlier.
Yeah.
But what can you do? And so pretty happy with where I am. And I think medicine is nice because I also like serving other doctors. And
Yeah.
I don't think I'd be able to do that as well if I wasn't a doctor. There are some people that work with doctors and do great and help them because you don't have that shared background. And I think people are almost to a fault very trusting to other doctors. We tell people to hold us to a higher standard than they hold other people, not a lower standard. But I actually did get a master's and thought it was not that useful because I had been in business for a couple of years already and I had learned all that stuff the hard way.
Yeah. What's interesting, very inspiring story, because you've helped thousands, probably tens of thousands of doctors now through your communities, your courses, your education, your outreach. So you're doing great work and you're finding strategic partners, you're making a difference. And then one thing about medicine is almost like we're conditioned to have, it's like a one-way track, but then real life is actually there's twists and turns, detours. Kudos to you. So how can people find you on social media, follow you, or contact you?
So my podcast is From MD to Entrepreneur. I interview industry experts and talk about my journey in entrepreneurship. So people might like listening to that. And then if they're interested in investing in real estate, there's ascentequitygroup.com.
Yeah. And for all the listeners out there, Pranay's resources will be in the links and show notes. Like I said, I've really enjoyed knowing you over these last few years, and hopefully we'll meet in person one day at the Passive Income MD conference. So thanks so much. And thanks for coming on to the show.
Thanks, Chris. I really appreciate it.